Respected Chair, I'll share my presentation on family planning program in Bangladesh, and my focus will be issues and challenges of the family planning program. All of us is aware that Bangladesh is a very populous country and have over 165 million population, and there are 45 million women with age between 15 to 49, and 80% of them are married, and the number is 36 million. Almost all the married women and some of the unmarried women have need for family planning services. And in Bangladesh, in 2022, estimated 22.5 million women received modern method of family planning, contraceptive methods, and among them, most of them are married, and only 160,000 estimated women were unmarried. And from the Bangladesh Family Planning Program is historically a successful program, and one of the major contributor of reduction of maternal mortality, newborn mortality, and also stillbirth, reduction of stillbirth. Estimated 27, I don't have slide on that. I'm changing. It's a slide 9. I'm changing. So estimated 27 maternal deaths are averted every day as a contribution from the family planning, and every year the number is 10,000. At the same time, 8.1 million unintended pregnancy are averted through our national family planning program or contribution of our family planning program, and 4.26 million unsafe abortion are averted through this program. But even then, we see there is chance of improvement, there is scope of improvement of our family planning program. If we consider the coverage, after our independence, we have a very rapid decline of our TFR, total fertility rate, and we observe it in different studies and surveys until 1994. And after that, the decline rate for TFR becomes slow down until we observe it 2011 demographic health survey. But after 2011's demographic health survey, we have another 3 surveys. In all these surveys, we found that there is a stagnation. The TFR is 2.3 in 2011, in 2014, in 2017-18 survey, and the most recently disseminated 2022 survey. We need to explore where is the challenge, what is the issue, why we are not achieving our target, which once we were thinking that we are just near to the touching point. We also see that these 3 different time frame also have the different pattern of contraceptive prevalence rate, and there is more stagnation in the recent or last 1 decade. So I'd like to explore more about social behavioral change communication. We know the most important success factor for family planning program and EPI program in Bangladesh was very effective social behavioral change communication, using mass media, using interpersonal communication by a dedicated health workforce, one by FWA, another by health assistant. Let's check. Just in a difference of 10 years, in 2007, we see that 7% married women read newspaper or magazine, which goes down 3%, where education rate among married women increases twofold. TV keep the same pace, but we know the impact of television goes much down. Radio, 90% women listen radio at least once in a week. It goes down to 2%, and all these three medias where the reach by all these three medias was 2%, it goes down to 0.4%. Do we change our SBCC strategy for family planning? Most probably the answer is no. Again, sorry. Again, if we look at the message heard, saw, or read by the women regarding family planning service, we see there is a sharp decline over the period because we don't change our SBCC strategy, and that's why its impact goes down. At the same time, if we look at the interpersonal communication, the FWA or family planning field workers from the government as well as from the NGO reach the women. They provide the message and sometimes some of the short-acting methods. And we found in different studies that all the people, all sorts of people with level of education, the reach was higher in 1993 survey and gradually come down, and there is a stagnation now. And in the most recent Bangladesh Demographic Health Survey, we found that in last 6 months, only 20% women were contacted by a family planning field workers from the government and the NGO, and the lowest rate is in Dhaka division, only 14.5%. So the strategy need to be revisited. And at the same time, we found that the access to electricity increase, and it becomes an universal access, 99%. People now have mobile phone. 2/3 of the recently married women have the mobile phone, and mobile phone access by family is also universal. And also the secondary education rate increases. Do we want to take the benefit of that? Most probably not. And for that, we see that our SBCC program have much less effect. Regarding program, we see that there are change in the performance by division. This change is visible if we look at the Sylhet division. There is a constant effort, and that gives some positive response. Still, we need to have particular focus how we can give a better coverage in almost all the country. We cannot plan only for 1 or 2 divisions. That was done in the present sector program. We need to be holistic. We need to target with specific population who are lagging behind, not generally target the division. Regarding adolescent, we all see some lights, particularly from the last demographic health survey, but the pathway is too long. But I want to give one special emphasis on the elderly women, particularly 40+ women regarding their reproductive health. If you look at the Bangladesh Demographic Health Survey findings of 2017-18, one-third of the family planning method that they used is traditional method, and one-third of the women's family planning demand are not satisfied by the modern method. They are most vulnerable. We should focus, along with the adolescent, we need to focus with the elderly women who is aged from 40 to 49. So another area is lagging behind, the urban area. If you look at the 2017 demographic health survey data, the female sterilization, male sterilization, implant coverage, and overall LARC coverage, that is below the national average and below the rural coverage. So the urban area needs special focus. We have family planning program countrywide, but the primary, secondary, and tertiary level facility belongs with DG Health. We need to have a very effective and very thoughtful plan for institutionalization of family planning in DG Health services. We need to focus on leadership and governance, ownership of the DG Health. Service delivery need to be addressed. Health system financing should be focused. Health workforce need to be trained. Medical product, particularly the contraceptive methods, need to be available there, and health information system need to be strengthened for family planning in DG Health. So otherwise, we cannot ensure postpartum family planning and particularly clinical contraceptive only through the DG Health, DGFP. So if we look at the coverage, particularly the long-acting reversible contraceptive, it was 1 minute. It was 8% in 2014 survey, become 9% in 2017-18 survey, again returned to the 8% in the most recently disseminated demographic health survey. So that is one of our major challenge. We need to look at these issues. How many implant provider in our country? Only doctors, and mostly the DG Health, DGFP doctors are providing implant. Hardly 300 to 400 doctors are available throughout the country. And we are sticking that with the policy that mid-level providers will not provide implant. But WHO guidelines and all the evidence shows that mid-level provider can provide the method. And for that, our discontinuation rate is 37% overall, and that is high in male condom and pill and injectable. So there is, if we look at the services, overall our services are more depending on private sector. And in the most recent demographic health survey, we see that the pill, injectable condom, IUD implant, in all these area, I repeat, the stake of the public health system reduced. That is not a good news. But the good news there is that IUD and implant coverage in the private sector was minimum, and that increases. IUD coverage by private sector was only 6% of the total, which increased between only one survey from 6% to 20.7%, and implant 2% to 6%. That is good news. And with public sector, NGO sector's contribution drastically reduced, and that impact, that is probably due to the funding constraint for the development sector. So with this information and observation, I feel that we need specific program targeting the underprivileged and underserved population we need to increase access to the service, and we should have a evidence-based SBCC strategy that need to be adopted with the present situation and present context. Thank you, and sorry for the extra time.